heard a story a few years back about a little girl in Texas who suffered multiple injuries when she was trapped in a well for 3 days. An injury to her forehead occurred when her foot wedged against her skin during the fall and remained there the entire time she was stuck in the well. After she was rescued and hospitalized for treatment, plastic surgeons were called to the scene to perform a relatively simple procedure called tissue expansion to repair the damaged skin. This recent surgical breakthrough makes it possible for surgeons to grow new skin from an area nearby, or to stretch adjacent healthy skin, just like a woman's stomach stretches during pregnancy. In this short tape, you'll learn if you can benefit from tissue expansion, what to expect of the operation, and what recovery will involve. Tissue expansion was first used to reconstruct breasts following mastectomy. Today, the technique is also used to repair skin damaged by birth defects, trauma, or tumor removal. It can also be used for aesthetic or cosmetic purposes, such as breast enlargement or hair replacement. When larger defects are involved, tissue expansion is a multi-step process. A silicone balloon is implanted beneath the skin, usually adjacent to the area, to be repaired. Then the balloon is gradually filled with a saline or salt water solution over a period of weeks or months. When the skin is expanded to the desired degree, the balloon is removed along with any damaged or defective skin. Then the new skin is positioned and sutured into place, covering both the defect and the area from which the tissue was generated, so that both areas look normal. Finally, about 5 months after the expander is removed, the outer layer of skin thins, the layer beneath it thickens, and the scar tissue dissolves, returning the body to its previous state, but with new, additional healthy skin. When the area of skin to be replaced is relatively small, a quicker, more immediate form of tissue expansion may be used. This less extensive procedure can be completed during your initial surgery, rather than over a period of weeks or months. However, this is a relatively new technique that may not be suitable for you. Consult with your plastic surgeon.
How can I tell if tissue expansion is right for me?
Virtually anyone can benefit from tissue expansion. Newborn infants, senior citizens, and everybody in between. The procedure can be used to replace flesh on almost any part of the body. Most commonly, tissue expansion is used for the breast, scalp, head and neck, or arms, legs, and trunk. Tissue expansion may be used to reconstruct breasts when mastectomy has been performed to remove a cancer, when young women have inherited breast deformities, or when cosmetic breast enlargement is desired.
Tissue expansion is also currently the procedure of choice for repairing defects in the scalp. While the procedure produces no new hair follicles, the existing ones are uniformly distributed over the expanded skin, resulting in evenly distributed hair when the operation is complete.
The procedure is ideal as well for reconstructing areas of the head and neck following injuries or tumor removal. Since the texture, color, and hair-bearing qualities of the facial and neck skin are so different from that of other parts of the body. When large areas of the face are involved, tissue from the neck can be expanded and transferred to the face. Additional applications of tissue expansion include development of new skin to replace areas on the hands, legs, and trunk that have been damaged by injury, birth defects, or tumors. Your age, skin condition, medical history, and other factors will help your plastic surgeon determine whether and how you'll benefit from tissue expansion. For example, it's possible that you may be advised against the procedure if the skin on the affected area is excessively damaged.
I think it would be good.
Will the procedure be real expensive?
The physician, operative facility, and anesthesia fees for tissue expansion vary widely, depending on the length and complexity of the operation and on what part of the body it's being performed. If it's being performed as a reconstructive procedure, all or part of the cost may be covered by your health insurance. If it's being used for purely cosmetic reasons, as in breast enlargement or hair replacement, it may not. Before going ahead with surgery, you should check with your insurance carrier to find out what your policy covers. When it comes to surgery and medical bills, nobody likes surprises. Though they're quite minimal, there are also some risks you should consider. For most people, the most common concern is that the tissue expander will explode or deflate if it's in the body for a lengthy time. While this may occur in rare cases, the saltwater solution is readily absorbed into your system, and the expander can be easily replaced. Also, if your tissue must be gradually expanded over time, your appearance will be temporarily altered while the expander is in place. However, most people are willing to put up with this temporary inconvenience in return for the long-term benefit. The only real disadvantages to the gradual form of tissue expansion are time-related. 2 operations are required, one to implant the expander and one to remove it, or in the case of breast reconstruction or enlargement, to insert a permanent implant. In addition, several outpatient visits to your plastic surgeon to have saltwater solution injected into the expander are usually required. You'll go over each of these details with your surgeon, as well as the type of anesthesia that's most appropriate and the kind of medical facility in which the procedure will be performed. Don't hesitate to ask questions. Open discussion before surgery will assure that your expectations are in line with what the procedure can realistically accomplish.
Will I have to do anything to prepare for the surgery?
Yes, depending on the type of anesthesia used, you may be asked to abstain from eating and drinking for several hours beforehand. You may also have to take some precautions if you're using any medications.
Depending on where the expander is placed, the initial surgery can take up to 4 hours.
If your skin cannot be stretched in one step during the operation, it will take about 8 weeks of gradual inflations before you undergo the second operation to remove the expander and suture the new skin into place. The length of the second procedure will depend on where the damaged tissue is located.
And afterwards, how long till I'm back to normal?
Again, that depends on the length, complexity, and type of tissue expansion you've undergone. Your plastic surgeon can discuss this with you. Your emotional health can play an important role in your smooth recovery, and a realistic understanding that the operation cannot be expected to be an overnight solution to any social, sexual, or business difficulties you might be having is also important. When the operation is for relatively minor tissue expansion, patients are usually back to their normal routines within a day or 2. When a defect is large enough to require gradual inflations of the tissue expander, most people have no problem keeping up with their usual schedules. Following the second surgery to make use of the expanded tissue, most patients are feeling much better and up and about within a week.